All right, what's up guys? Dr. Dan here. We got Jason in the house. Jason is a patient that has been here for about 6 weeks now. He is a pilot. He flies from Pittsburgh, where to?
Memphis based, and then from there around the world.
Around the world, internationally.
Yes.
Last week you flew to?
A lot of Asia.
Asia.
Stuff, yeah. Hong Kong, China, Japan, Taipei. So
Awesome.
We've gone about 13 days on the road.
And then you come home for?
Week and a half, 2 weeks usually, and then back out again. So home was all home this week, home next week, leave Friday, and then I'll be gone about another 12, 13 days again.
Wow. So everybody's got different jobs, number one. Everybody's got different time schedules. We see a ton of people in here that work in an office, you know, from 8 to 4 or 9 to 5, and then they're home during the nighttime and during the weekend. They can establish, you know, different stretch routines, different times to exercise. Jason, on the other hand, he's gone for a week, 2 weeks at a time, and then he's home for a week, 2 weeks at a time. Your 2 weeks off, you've been increasing what kind of things here?
A lot of mobility, stretching, starting, in the morning, afternoons, nighttime, anytime I can think about it. I try to get some kind of stretch in. A lot of stuff that we work on, just at the counter, in the shower. A lot of good time to stretch before workouts, after. Trying to increase mobility, stretching that I never really did over the years.
But always kind of active, right?
Right, active, a lot of workout, weights in the past, ride a bike now, Peloton, so I try to, I warmed up a little bit, but never really took the time at the end of workouts to stretch. It was just kind of one of those afterthoughts, so I'm trying to incorporate more flexibility and stretching before and after workouts. More stretching, it seems, than the workout itself.
Than ever before, right?
Mm-hmm. Right.
So, Jason, also on the plane for how long? Like
anywhere from, if it's a short flight, an hour, hour and a half, to 14 hours at a time.
And so a lot of time sitting.
A lot of sitting. I try to, on the long haul stuff, I'm trying to get up more, and at least once an hour, and try to get some stretching in. We have an area in the back of the airplane, a courier area that's got 4 passenger seats in our galley area, so I can get up and move around a little bit, stretch. We've got a closet so I can get my arm up on it and stretch like through the chest.
Nice. But were you doing this stuff before you started a little bit?
No, not really. No. Even in the seat, we've talked about with ankle and trying to move around and get my foot back and get some mobility and flexibility in the ankle and the feet. I try to do that more often. I think much more cognizant of it. I never really thought about it in the past.
Mindfulness.
Right.
So, when you started coming in here, you were having complaints of what?
Mostly the lower back, some neck tightness in the neck, and kind of the upper back to the left and right of the spine. But most recently, probably for the past year and a half, it was a low back, just above the hip, left side of the hip.
Okay. So right from day one, this is maybe his 7th, 8th session in here, I'm not real sure, but right from day one, we talked about the muscle system, the skeletal system, how important it is to balance everything out, how important it is to be mindful of the left side, the right side, the way that you're sitting, the way that you're standing, and especially when he's in a plane for 10 or 12 hours, trying to make sure that he's tying some kind of seated exercises in, as well as if it's possible to get up and, he's got a break for a little bit while the other pilot takes over to stretch somewhere, wherever he was saying in the little galley or whatever, right? Mm-hmm. So right off the get-go, guys, palms back and down. Jason has been gently working on developing a little bit of a better sitting position, a little bit of a better flexibility through the front of the shoulders. Definitely working on the back chain activation so that we can get him nice and powerful and opened up through his shoulders. and upward lifted through the spine, especially like right down here. So let's arch up a little bit taller, nice. And then what he's gonna focus on, what we're gonna work on, is gently spreading the fingers. I know it's gonna be tough, bro. And his hands are cold. It's getting colder out here in Pittsburgh, guys. So what is so awesome, how tough is this? This is tough, right? It's gotten easier.
Definitely. Right, it's definitely easier. It's always a work in progress.
And what this is doing, so when it's getting colder out, if you have any kind of like bad circulation, Raynaud's phenomenon, numbness and tingling down into the fingers, circulation gets restricted when the neck is compressed, the cervicobrachial region is compressed, so like the neck, the front of the shoulder, the elbows, especially like the inner elbows and the biceps get really tight. Real quick, like what's your flying posture?
Typically, most of the time the autopilot's on, so I kind of just basically
Pay attention to
sit.
it.
Yeah, you're just monitoring mostly. But I mean, when you're flying, you usually have one hand on the yoke and one on the throttle, and then if I don't, sometimes I'll put both hands up on the yoke
And does
when
the
I'm
seat
flying.
lean back, or is it like a fixed seat?
No, you can definitely lean it back. So I've tried to, once we get in the air, you'll lean it back a couple notches just to get a little more comfortable, but trying to not use so much of the front chain. I'm trying to keep it more upright, so I'm not leaned back and
Kind of rounded too
right.
much,
I'm
right?
not trying to activate more of the back chain, as we were
Nice.
talking about.
Hands back. So this stretch, you see it on every video. You're going to see it on every future video that we ever shoot, because it's so important to reduce neck tension, power up the back, strengthen the triceps, open up the brachial region, open up this awesome neurovascular bundle that so many of us cause compression into, and then we end up with poor circulation, nerve irritation, muscle strains in the biceps, the forearms, the fingers get so tight. So just by sitting here, we're going to spread his fingers a little wider. And now what we're going to say, just can you gently raise up like that, and then push forward a little bit and take a breath in through your nose and exhale and push. Nice, that's so perfect. And what he just did there was set his shoulders down so he's not so neck tight. And then he's going to focus on a little twist through the right side and a little twist through the left side. You can do this for 10 or 20 seconds, and then over to the right side for 10 or 20 seconds. Cool. You're going to do this, maybe if you can do it in your pilot's chair and just kind of sit there for a little bit. You know, you've got 12 or 14 hours on the plane. I would recommend try to spend 30 or 60 minutes. If you can break that up into 5-minute or 6-minute intervals, you're going to get off the plane, you're going to walk taller, your back's going to be much healthier. Other good thing here, let's transition back to flat palms if we can back there. And now let's lean back into flat palms. And this is an awesome tricep builder, back chain muscle activator, scapula builder. Also helps us to reduce neck tension. So if I say drive down through your palms, let's think about lifting spine up like that. And let's focus on how tight this left palm, push down through that left palm. And now maybe we want to kind of push away from it a little bit. Or maybe we want to push through the right palm and see how we can kind of push away from that side. This actually seems to be a little easier on this side, I think, than this side.
Yeah, it's definitely left feels
a little tighter there.
Yeah.
Cool. So that's one thing we want to work on. And then we coil. We coil with the right coil. We coil with the left coil. And again, we hold for 10, 20, or 30 seconds, left side, right side, back to center. And you can put hands on thighs now.
I also, usually you had mentioned, which I've really tried to work on, anytime I'm pulling my suitcase, my roller bag, I'll try to really work in that back chain lat, try to activate, and I'll switch. I'll start with my right, and then I'll, at some point when I set my bag up, I'll try to grab with my left hand and try to do it with the left, and just trying to maintain the upright posture, trying to get the lat activation in the back.
Does it feel good?
Yeah, it does.
So guys, Brie, our video girl, years ago we had a question that says, how do you carry your luggage through the airport? So we shot a video on it, and we talked to everybody that travels frequently, but now you hear right here from a pilot. Engage your lats, keep your posture upright. If you see this guy in the airport anywhere, say, dude, your posture looks great. How's your lats feel? Because your lats are going to feel great, and the more your lats feel great, the better your neck feels, the better your body can breathe O2, and your circulation just gets so much better. Your core gets stronger, and then you feel just more powerful, and you feel more upright, and you don't have to worry about too much neck pain, neck strain. Cool? Let's go face down on the table for me. Stretch session with Jay. A little bit of back work, because we've got some core work to do with him off video, and definitely since we started has made good improvement in his knee flexion. Got lots of toe flexion to work on, okay? Lots of time that you're gonna spend on the airplane, kind of sitting, as we talked, on the outside edge of your foot, kind of stretching this region out. Gradually, as you stretch the foot out while you're sitting, it's gonna help the IT band and some of this glute and IT band tension up on the outside edge of the hip. We talked a little bit about the rocker on one of your appointments. Is that correct or no?
I think so.
Which is where you sit down on your knees, toes down, and then heels up and out.
Yep.
So that's definitely going to be easier for you as you continue to gain this full knee flexion back through here. But it is something that when you are home, and it's a rainy, cold day out, and you've got some time in the living room and maybe some rest time, maybe you want to read or maybe you want to watch TV. Like last Saturday, it was rainy and cold here in Pittsburgh, and I woke up and we were like, let's just lounge in the living room for a little bit. And I spent about an hour and a half down in the rocker position, got my legs flexible, got my hips flexible, stood up, and I hobbled around for a minute until everything kind of reorganized.
Right.
I'm gonna raise shirt up,
Okay.
all right? So for some of our patients that are tense through the low back, the mid back, we'll do some paraspinal, what we call paraspinal myofascial release. And we're gonna feel just how tight some of these lower back muscle fibers are. But much improved from when we started.
Yeah, the pain that I had initially when I came in, I don't have any longer.
Awesome. And that was like left side low back. And
Right, yeah. Like I'd wake up in the morning, just the first few steps to get out of bed, it was very painful, almost to the point where it was hard to walk.
Now you're still, as we tell all patients, no matter how well you are, you gotta exercise, you gotta stretch. Both of those things have to be done correctly. But you're still gonna wake up when your body is kind of like just not mobile all night long. Super common to wake up and still be like, oh, I'm sore, especially if you worked out the day before or did a long bike ride, or maybe you got home from a 14-hour trip and even though you were still active on the plane, right? And when we go to bed, the body just kind of settles. So it's important to reset everything when you wake up. And we'll talk about some good resets, wake up resets. Let's go inhale deep into nose, exhale down, and relax mid. There's one. Nice. Breath in, and exhale down. Relax here. Nice. There's two. Breath in, and exhale down, shoulders down. One more in, and exhale down, shoulders down. All right. So you were on a big trip. He came in earlier this week. We didn't get anything to move because he was a little stiffened up again. But today we got his upper thoracic spine to move well. We're going to cover a wall stretch for him after we finish. Let's do this side gently. And this left side gently. On up. Nice. Good. Back to center. All right. Face me over here. Left side up for me. And then we're going to cross this and this. We're going to breath in deep. Exhale deep. 1, 2. Other side for me. And then we're going to talk about a rotate, 2 wall stretches today. Remind me at the end. We're going to do 2 wall stretches. Breath in, exhale, roll, away, roll. Good. Flat on back for me. Because we want to get his core to rotate better. All right. Let me lower this headpiece down. Another cool thing about Jason here is some patients come in full force. Like, I just want to feel better. I'm tight, I'm exercising, but maybe it's good, but maybe it's not perfect. Jason got his own hypervibe about
A couple weeks ago.
a couple weeks ago. saw and felt the power of the Hypervibe over in the gym. You're using it pretty good now?
Yeah, I use it, I try to use it, I'll do like 10 to 20 minutes on it before I do a upper body and lower body, 10 minutes each, and then I get on the Peloton and ride, and then when I get finished with the Peloton, I usually do like a little more of a cool down on it, stretching and just kind of standing and moving around, trying to let the vibration just, you can feel it just going up, trying to find the spots in your body that you want to release some tension.
Feel good and refreshed after?
Yeah. Sometimes it's great. There's been a few times where I've gone out at just, tired, or we're getting ready to go out for the night, and I'll just try to get on 5-10 minutes and feel it just wakes you up. Yeah, it does. It gives you some energy.
Yeah. So people always ask on the channel, on the YouTube channel, because we have a bunch of like how-to videos on there. What does it feel like, and what does it do for you? And so firsthand, he's using it every day, adding it into his current workout routine. Why does it make you feel energized? It just gets your blood moving. It stimulates your nervous system. If we're not stimulating the nervous system, we get fatigued. So exercise is one way to stimulate the nervous system. Hot and cold therapy as well, like cold baths. And a sauna stimulates the nervous system. Hypervibe, I think, is the greatest and the best because it's straight up vibration the whole way through the body. Plus, it loosens up your skeleton like you wouldn't believe. Okay, relax this foot. Now, we got one more here. We got, you did something to this toe a long time ago, huh?
Yeah, right there.
Oh, you feel that guy? Wow.
Yeah, I never noticed it before until you
start mashing on. This joint is incredibly crooked, twisted, okay?
Yeah, I can't remember.
On your Hypervibe, you're going to focus on, I'll show you over in the gym, okay?
All right. Yeah.
All right, cool.
Yeah, I had never noticed that until when you said that, you started pressing on it. I was like, wow, yeah, that hurts.
So we're on his third little toe right now. Third toe right here. Okay, fourth toe's good, third toe's all kinds of twist up. He's got a little calcific deposit on the top of the toe right here, which is caused from basically tendonitis of the peroneal muscles. So he's got wickedly tight peroneals. He needs a lot of back chain activation, which he's just started 4 or 5 weeks ago. We're going to see that his calves, his hamstrings, his plantar fascia are going to get much stronger. He's going to lay in bed and I work on his foot squeezes. You guys will see it. The formula is the same. Everybody's got different problems, but the formula is the same. Get the back chain connected. Get your front chain flexibility. So Jason's going to lay in bed at night. He's going to point his feet down. And he's going to use his brain to squeeze his left toes down. And he's going to hold this perfect right there for like 30 or 60 seconds. And then right side for 30 or 60 seconds. You got to feel the bottom of the feet cramp up as you do this. You got to feel gradually, softly that you're sitting here and you're squeezing your toes down. Now, also, it's football Sunday or something like that. I'm sitting on the couch, my feet are up on the ottoman. I'm leaning back on the couch. I'm still working on connecting myself to my toes, which will help your calves get stronger, your feet get stronger. Nice. Nice. Thumb. Nice. Elbow, we've had a couple times. Head relaxed. Not today, though. Now let's see after we adjust the neck if we get it. Hand here. Head straight. Right there. Left hand. Now we got the whole right hand. Good. But it is his left neck. So the left fingers and the left thumb get a little more jammed up than the right side. There's the left elbow, though. Let's hold here. Let's do this. Let's go. Feet gently touch together lightly. And just bottoms of feet inward like that, okay? That's your perfect in-bed lying position before you fall asleep. It's spread fingers wide. It's light press down. It's light focus through the heels. It's light knees twist open. And you want to just kind of hone in and see how this feels. And maybe you think, Can I roll my right shoulder open? Beautiful. And you're connecting yourself to your right lat over here. And then left flat on the left side. Nice. And then reach your fingers down a little lower. And now press down softly. And now let's focus on straight and left elbow. But left shoulder's got to stay open. Oh, good. And now left hand, left thumb. And now focus on the right. And feel these guys stretch out long ways as you softly keep these back into your lats. Thumb's got to be down, fingers laid down. Nice. See how tough that is? You close your eyes in bed. You develop the mindfulness into the back chain. You spread your fingers. You feel how your fingers are tight. Your hands are tight throughout. And then we relax up into the neck. We're going to do this left easy. Relax your left neck. Keep your hands lightly pressed down. Nice. And now right shoulder down on the right. Nice job. Okay, bro. Sit up tall for me.
Yeah, it's hard to sometimes you get that mind-body connection. It's a constant work.
Constant work. We have a lot of static throughout the day, a lot of stress, a lot of stuff and things that come into our head, a lot of stimulation. Eyes get stimulated, ears get stimulated, listen to the radio, listen to all the stuff, the crazy stuff in the world, blah, blah, blah. See all the bad stuff on the news. Hopefully if you don't pollute yourself with that too much, because, oh God, it makes you less mindful of being in focus and in control in your own body. Got to develop the focus within the body, got to calm the body. The way we calm the body is through mindfulness, through exercises, through sensation, tactile sensation, and the hypervibe stimulates that. Adjustments stimulate it also at home and in the gym, stretching and therapy. Cool? So, sit up for me. Now we're going to hit his right elbow on his next appointment, but what I do want you to do is go right hand up, and you're going to go left hand pushes here, and you're going to meet pressure together.
Okay.
And you're going to think, can I open my shoulders up a little bit? And can I reach my elbow? Hold right there nicely. Now your primary focus is on your right arm. You're going to tuck your elbow in a little bit, and you're going to try to stretch that guy out softly. Do you feel how tight that is? And do you feel when you meet pressure here? Nice. And you're going to straighten that elbow gently. All right. Oh, feel how shaky that is. Bend it back and in and just kind of meet pressure lightly. Stretch your neck away to the left side. Feel how that pulls up into the neck tightly. Softly raise away a little bit. Tuck the elbow in lightly. Nice. Feel how that's a little shaky spot. We're stimulating the core and we're spiraling the arm to help release tension on the medial elbow, create a stronger bicep, a stronger tricep. We're going to relax, grab the hand, and you're going to just twist it out. And you're going to straighten it out lightly. And now we're going to lean the head away over to the left side. And you're going to focus on how that left hand wants to grab and twist. And maybe you want to bend the elbow back down and in. Good. Oh, feel how tight that is. Now pull that shoulder blade back. Back, 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 back. Oh, that's a little bit forward. So he's a little bit here. So we're going to work on this backward pull with the twist. There you go. Lean the head away. Feel how that kind of opens that arm up. Reach it back out. This is going to help him uncoil and untwist from all the driving and flying and all the control stuff that he's got to do this way. Easy to do. Sit back in your seat on that flight. Start stretching each hand out. Also meet pressure and work on how that stretches the connective tissue in the elbow. Okay? And you can do both. Yep, you can just do that. Stretch the head away. Reach out, tuck the elbow in far. Nice. Pull the head away from the shoulder. Okay? Bend it back and in. If you want to, you can bend the wrist up. You can start to get a nice wrist flexion. Nice wrist flexion stretch like this. Cool? Spend time twisting out this way. Put hands together in this position. Reach out forward. Tuck elbows in lightly. Straighten elbows up tall. Nice. Think thumbs open outward. Feel how that's kind of tough to do that. This is your offering position back in the day, right? Here you go. I'll give you all that I have. Now I gotta go back to work and make more. Or, the kings and the queens present, okay? Stretch neck right. Stretch neck left. But you're giving. You're grateful that you're passing it out, right? And you're holding those elbows tall away. And you're focusing on how those biceps got to stretch and the triceps engage. Cool?
I can even feel like it's almost
fatiguing.
Yeah, it is. It's like tiring.
Real quick, right? So this guy goes to the gym, he works out, he rides bikes, blah, blah, blah. We put ourselves in these body weight positions, which are midline exercises, which help connect the brain to the left and the right side of the body. And then we open up and we coil. Second thing I want you to do this week, Jesus pose. Palms up, elbows out a little bit. head up tall, and just relax and wiggle neck around. And now let's reach the hands out just a little baby bit further. And now let's think about the right thumb tip twisting back. Nice. And you're gonna hold and hone in right on that shoulder blade in the back. And then left thumb tip down. And you wanna think, can I raise my head up nice and tall? Again, here's the movement, here's the answer. It's like, pass it out to everybody, open the fingers up wide, stretch your elbows out a little longer. Take a breath in through your nose. Exhale out, straighten those elbows a little bit, lift your head up, be proud of and tall up in the chin. Think about right elbow back, or right thumb back, right elbow in, left thumb back, left elbow in. Stretch neck left. This is a great position to hold in the shower. You want to be, if you're in a standing position, straight foot outside edge pressure, so that we can develop this coil system. The coil system is down into the right, down into the left. Boom, 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 tall, okay? If you do this the right way, you're gonna get a cramp down the back shoulder. You're gonna feel how it stretches the neck and the front chain. It's gonna help open you up. You wanna hold this for about 5 minutes a day, and it's just gonna be nice and cleansing for the energy throughout the body. It's gonna help to reduce elbow pain. It'll make my adjustments with him much easier. Cool? Now, we got 2 back chain stretches, then we gotta finish up. So, stand up for me. 2 things we wanna work on. We're gonna do a wall transition series. Fingers nice and wide. We're gonna step feet back, keep feet straight, bend knees open, slide hands down, and shoot hips way back. Let head hang down low. Look and see that feet are straight, knees are open, bend a little bit more. Bend a little bit more, nice. Now if you raise heels up gently, you wanna practice this as a squat position. Take a breath in and an exhale, don't hold. Nice. And now put heels down, lift head up, chest up, turn fingers in a little bit. And let's just use, now what we're gonna transition to, my man, is we're gonna try to come up off the palms, nice. And you're gonna lift head up, chest up, and what you're gonna hone in on is trying to feel this cramp strain right through here. Heels are down, let's sink, yes, nice. And breathe in, and exhale and sink right into it, okay? Now we're gonna really put him in his back chain power, his feet are straight. I just need a little bit more knee twist open, beautiful. Inhale deep, exhale deep. Now let's bend elbows down and in, keep palms down now. And nice, now we're gonna work on your push power through here. And consciously, you're gonna say, can I squeeze this side up a little bit? And you're gonna really let this stuff burn and activate. And then you're gonna do it on the left side. You're gonna focus on activating this left side. This side's probably gonna be a little harder to talk to. Is that correct?
Yeah.
Because his left neck was his crooked neck. So his brain is patterned up here, it's not patterned down here. You can feel this easier than this. So he needs to work on his left coil system, which is going to significantly help us improve his adjustments. So maybe 3-4 weeks from now, if he holds this for 5, 10, 15 minutes a day, you can break that down into sets of 4 or 5 minutes, and you can work on your back chain power. How about we bend elbows? And now we tuck elbows in, and we inhale deep, and we exhale, and we think hands push, head lifts up, and chin tucks back nicely right through there, okay? Nice, and you want to kind of work on this position.
Okay.
Also great to do this down on the floor in the hyperbod. Cool?
Okay.
Keep hands right there, walk feet up. Step 2 of this is going to be stepping to the right. And then we're just going to work on some light wall push-ups as we look over here. Okay? And then we're going to squat double bow set down into it. Knees open up. And maybe you want to twist over to the right. There we go, boom. Now maybe we want to twist over to the left. Here goes. There we go.
Oh, you're cracking.
Right? Now we rotate it around. Left foot forward, right foot back, outside edge pressure. Maybe we want to just work on some light push-ups through here so we can develop the upper body strength. Nice. Inhale down, exhale up. Maybe we want to squat into it, bend knees, twist to right, stay left knee opened up, don't let it collapse. There you go. Now twist to left. You hear me, guys, because we go through this movement a whole bunch. Core strong. You take control of your own spine, you got to follow the protocols. Cool?
Absolutely.
All right. I hope you guys liked the video. Big J here, making changes in his life. If you're in pain, if you're in injury, follow our YouTube channel, follow our system. If you want to come to Pittsburgh, get treated, give our office a call or email us. Thanks.